Welcome to the Persistent Pelvic Pain Group. This session is led by the Ashford and St Peter's Specialist Pelvic Health Physiotherapy team. This session is designed to help you gain knowledge and learn ways to help manage your persistent pelvic pain. We will discuss what persistent pelvic pain is, the structures in the pelvis involved in persistent pelvic pain, and we will then discuss the starting points of self-management strategies, and you can begin using this advice straight away. You will also have a one-to-one appointment with a specialist pelvic health physiotherapist to complete a full assessment, provide diagnosis, and tailor your treatment plan. Please note that this advice video is only to be used by patients referred into the Pelvic Health Physiotherapy service at Ashford and St Peter's Hospital. So, what is pelvic pain? It's pain anywhere in or around the pelvis. This could be pain all of the time, or it could come and go. This might be dependent on activities, such as sex or exercise, wearing certain clothes, or it could come on for no apparent reason. So when we say that the pain can be anywhere around the pelvis area, let's look a little bit closer about where we might be talking about. This picture is looking at the bones of the pelvis from the front. The pelvis is a ring shape. You can see we have the lower back and the sacrum coming round to the front of the pelvis where we have the pubic symphysis, which is where the bone attaches. The hip joints sit at the side, slightly towards the front of the pelvis. This next diagram is looking at a person side on with female anatomy. Starting at the front, so at the left-hand side of the picture, we have the pubic symphysis, which we saw in the last picture. Then the bladder and the urethra, where your urine passes out of, the uterus, cervix and vagina, and at the back, so on the right-hand side of this picture, we have the rectum and the anus. Moving on to the muscles now. Again, this diagram is side-on with the front of the pelvis on the left-hand side of the picture and the back of the pelvis and buttock area on the right-hand side. This picture shows us how many muscles are involved in helping to stabilize and move the pelvic area. Moving on now more specifically to the pelvic floor muscles, which are shown in orange on this diagram. The pelvic floor muscles are a large group of muscles that stretch from your tailbone behind to your pubic bone in front, forming a bowl or a hammock shape of muscles. They support your pelvic organs, including your bladder, bowel, and womb. And they also have a role in sexual function during intercourse. Your pelvic floor muscles provide extra support when you cough, sneeze, or laugh to help prevent leakage from your bladder or your bowel. When you pass urine or a bowel motion, your muscles should relax and then tighten again afterwards. This helps to prevent leakage and controls the passing of urine and bowel motions. Like any other group of muscles, it is important that the pelvic floor is able to contract and relax through its full range in order to work effectively. If your pelvic floor is not able to relax, not only might this disrupt your normal bladder and bowel habits, but it can also lead to pain or discomfort. Your pelvic health physiotherapist can offer you an internal examination of your pelvic floor muscles to assess its strength and mobility to see if this is contributing to your pain. You may then be given specific exercises to help you. Diaphragmatic breathing, for example, can be used to help the relaxation and mobility of your pelvic floor. Lastly, it is important to mention the importance of the diaphragm when it comes to the pelvic floor muscles. The diaphragm and the pelvic floor work together in partnership. When we breathe in or inhale, as the picture on the left shows, the pelvic floor and the diaphragm descend. When we breathe out or exhale, the pelvic floor and the diaphragm ascend. Take a few moments to take a few breaths and imagine this happening inside you. Sitting in a comfortable place, close your eyes if you feel comfortable to do so. Place one hand on your chest and the other on your belly, just below your rib cage. Breathing in slowly through your nose, letting the air in deeply towards your lower belly so that your stomach moves out, causing your hand to rise. The top hand should remain still or only move as the bottom hand moves. Exhale slowly and steadily through your mouth. Tighten your stomach muscles so that your stomach moves in. Keep your mouth relaxed and repeat for a few repetitions. We call this diaphragmatic breathing. So for much of the day, we breathe apically, which means from the top of our chest, and rarely take deep breaths. Now we have a better understanding of the anatomy around the pelvic area. Let's move on to learning a little bit more about pain. There are many definitions and ways of describing pain. The International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. More specifically, for persistent pelvic pain, the Royal College of Obstetricians and Gynecologists define persistent pelvic pain as being usually caused by a combination of physical, psychological, and/or social factors, rather than a single underlying condition, although for many women a cause cannot be found. So what is going on inside the body when we have pain? Everything we experience, including pain, is possible because we have a nervous system. It's our nervous system that helps us to feel pain. The nervous system is a very complex system in the body. It has many parts, but can be divided into two main systems: the central nervous system and the peripheral nervous system. The spinal cord and the brain make up the central nervous system. Its main job is to get the information from the body and send out instructions. The peripheral nervous system is made up of all the other nerves in our body that are outside the central nervous system. The peripheral nervous system passes information from our body to the central nervous system. If we were to stand on a drawing pin, receptors, which are at the end of our nerves, are triggered in the foot. There are a number of different receptors that recognize different types of sensations. These sensations are sharp, hot, cold, and light touch. The drawing pin switches on the receptors that recognize sharp things. The medical term for these receptors is nociceptors. Once the receptors have been switched on, the message needs to travel up the nerve and reach the brain. It would be simple if there was one nerve that traveled from a receptor all the way to the brain, but the body is much more complex than this, and many nerves are involved in this process. Nerves are like electrical wires. When the receptor is switched on, an electrical signal travels extremely quickly along the nerve to the other end of the nerve. The end of this nerve is at the spinal cord. The spinal cord is inside and protected by the spine. Nerves enter the spine at many different levels. For example, nerves that come from the foot enter the spinal cord at the level of the lower back, and nerves from the arm and hand enter the spinal cord at the neck. The end of the first nerve is near the beginning of a second nerve. The gap between one nerve and another is called a synapse. The message from the first nerve is passed on to the second nerve by the release of chemicals known as neurotransmitters. These chemicals cross the gap or synapse and activate the second nerve, and the electric signal continues to travel to the brain. Once the message has reached the brain makes sense of it and recognizes that there is pain in the foot. This whole process happens very quickly. So why do we have these synapses? Synapses allow the nervous system to control which messages from the receptors are recognized by the brain and which are not. This stops us being continually swamped by information that we do not need. For example, wherever our clothes are touching our skin, the receptors in our skin can be switched on. Because it would be useless and very annoying to sense the touch of our clothes every second of the day, our body stops the electrical messages from these receptors from reaching the brain. The way it does this is that the second nerve in the spinal cord, the one going to the brain, is not switched on by the signal in the first nerve, which is the one coming from the receptor. The way that the second nerve in the spinal cord is not switched on by the signal in the first nerve is through other nerves which send neurotransmitter chemicals or messages and keeps it switched off. These other nerves act as a volume control for the strength of the signal that goes up to the brain. The volume control is turned up or down depending on the information coming from the other nerves. So when you put your foot on a drawing pin, the receptors in your foot are switched on, and then the nerve that goes to your spinal cord is switched on, and then the nerve to your brain is switched on. These are all at high volume. This makes you take the drawing pin out of your foot. As soon as you do this, the receptors and nerves switch off, and you stop feeling pain. If the drawing pin was long or jagged, then it might cause injury, but when the injury heals, the pain should stop. Are psychological factors involved in feeling pain? Psychological factors are involved when everyone feels pain. Many people think that the nerves carrying the electrical messages go to just one area in the brain, and then we feel pain. This is not true. These messages travel to many areas of the brain. Some of these areas are also involved in things like our mood, thoughts, memories, and past experiences. So, for example, someone puts their foot on a drawing pin. This causes an infection. They have to take antibiotics and time off work. Then 2 years later, they lean on a drawing pin again. There is more chance that this person will feel more pain and be more anxious than someone who has not had the same experience before. When understanding pain, it's really important to be well informed and educated. It makes it easier to communicate about your pain and explain your pain to other people, but also to be more confident at using pain management strategies, which we will teach you. There are 2 different types of pain: acute pain and chronic and persistent pain. Acute pain is a pain that lasts for a short period of time. It can last from as little as a few seconds up to about 3 months or 12 weeks duration. Acute pain is useful because it is the way that the body protects itself. If a part of the body is injured, pain helps us to recognize that something is wrong. This makes us do something about it, such as moving away from a sharp object that has cut our hand. We would expect normal healing timeframes for acute pain and injury, which is up to 12 weeks or 3 months duration. The human body repairs and protects itself when it is damaged. When part of our body is damaged, a cycle of repair starts automatically. This is called the healing process. An understanding of the healing process cycle will help you to understand persistent pain and what you can do to help your body. All areas in the body can repair when they are damaged. It does not matter if it is skin, muscle, bone, or nerve. The healing process may differ slightly depending on the type of body tissue and how badly damaged it is. However, overall, the healing process is the same. Stage 1 of the healing process is bleeding at the time of injury. The bleeding stage lasts from minutes to hours. The second stage is swelling or inflammation. Inflammation starts almost as soon as the bleeding phase starts, but it lasts a little bit longer. This stage of healing can last about a week. The third stage is the repair stage or proliferation. This stage begins 2 to 3 days after the injury and can last a number of weeks depending on the amount of damage. After 3 months, pain at the injury site is unlikely to be a warning sign that the damage has not healed. Long-term healing or remodeling is the fourth stage. This is a process where the healthy tissues surround the injured area grow back into the injured site and join with the scar tissue. Chronic or persistent pain is continuous long-term pain which lasts for longer than 12 weeks or 3 months. Persistent pain does not have the same relationship with healing as acute pain. The pain persists beyond healing. The pain is not telling us about something that just happened. When someone has persistent pain, it is the pain mechanism that was described earlier that goes wrong and does not switch itself off. Persistent pain can sometimes start for no apparent reason and sometimes following an injury. Even if the pain started following an injury, any damage that was there will have healed in a maximum of 3 to 6 months. However, even though there is no damage, the pain can continue. And this is because the pain mechanism has not switched off. This mechanism involves nerves and chemicals that do not show up on X-rays, scans, or blood tests. Therefore, the results of these tests would not show anything wrong with the painful area. This can feel frustrating. Even when the results of a test or investigation cannot find the cause of your pain, this does not mean that you are making the pain up or that the pain is in your head. You have a very real and physical pain. The problem is a fault of the pain mechanism. So how can this pain mechanism go wrong? Because the pain mechanism is so complicated, there are a number of ways in which it can go wrong. The receptors in the skin can fail to switch off. They become very sensitive, and so, for example, what used to feel like a light touch is now felt as very painful. The peripheral nerves, which are the nerves from the skin receptors to the spinal cord, can go wrong so that they can continually send a signal even when the receptor is switched off. The volume control that we discussed at the synapses can get stuck so that it is always at high volume, and so the messages from the spinal cord get to the brain very easily, and the pain is felt even if the receptors are switched off. This is called central sensitization. It is not the receptors that are oversensitive, but the second nerve in the pathway, the one that starts in the spinal cord, which is very sensitive. So why can't someone turn off the pain mechanism? The nervous system and pain mechanisms are extremely complex, and changes that contribute to persistent pain can occur in many places. This makes it hard for healthcare professionals to say exactly where the changes have occurred that are causing the pain. There is often more than one, and so even if one could be stopped, there will be others that continue to send messages that will mean you feel pain. This is the same for medication. Even if a medication stops the receptor from being sensitive, it may not work on the nerves in the spinal cord, which may also be sensitive and sending messages to the brain. When someone has had pain for a long time, it can begin to take over many areas of their life. Pain does affect everyone differently. Here are just some of the areas that people tell us have been affected by having pain. When these things happen in people's lives, they can make it even harder for people to manage their pain. After a while, it can feel as though the pain is taking over most aspects of people's lives. This can make people feel very helpless about what to do about their situation. Everyone tries their hardest to make their pain go away. Some of the things that people try in an attempt to reduce their pain can be helpful in the short term. However, they can become unhelpful after a few months or years and can make people's situation worse. Persistent pain often leads to a change in the way that people do things. Some people may find that they do less. For example, less enjoyable activities. They may be unable to work, do less housework, or rest more during the day. The level of pain that people experience is often inconsistent. People often describe having good or better and bad days. On better days, people often push themselves to do more activities. They push themselves until the pain tells them to stop. Then they rest and do less. When the pain goes back to its usual level, they then do more again. But the pain also increases, and so the cycle continues. This cycle of overdoing and underdoing things is called activity cycling. In activity cycling, it is the pain that is in control and guiding the amount of activity that someone does. It is understandable why people push themselves on a better day. For example, tasks may have piled up in the previous few days. Someone may believe that tomorrow will be a bad day, and so they feel that they have to do things today. These are some examples. There are many other reasons why people push themselves on a better day, though. Although pushing on a good day is understandable and does have advantages, for example, getting things done and people gaining a sense of achievement, there are also disadvantages. Disadvantages to activity cycling include an increase in pain, a few hours or days of not doing much. Not doing much can lead to low mood and isolation. Resting too much will result in weaker muscles, stiffer joints, and a loss of fitness. People often blame themselves because they feel they have caused their pain to increase. Frustration because they cannot do what they had planned to do the next day. And over time, the overall level of activity and fitness decreases. It is important to regain control of your activity levels and start to increase them without increasing your pain. You can learn how to do this when you're visiting us. We do know that using pain management strategies can show you how to make changes that can begin to reduce the effect that the pain is having on your life. It is a self-management technique, which means that you will initially get support to learn about your pain and pain management strategies, but the eventual aim is to help you to become the boss and to be the person who takes the control and puts pain management strategies into practice. Learning and putting pain management strategies into practice will not cure your pain. Unfortunately, where we are in modern medicine, we do not know how to cure persistent pain. However, these strategies can help to reduce the effect that your pain is having on your life. It will take time and motivation to learn these strategies. Some of this is trial and error to begin with. You will try something and it may not help, or you may not get it right the first time, but this is normal. If this happens, please talk to us and try to think what you can do differently next time and try again. People can find it hard to make changes and practice pain management strategies. However, we know that if people practice pain management strategies every day, they are much more likely to reduce the effect that the pain is having on their lives. So what influences pelvic pain? Pelvic pain can have a number of influencing factors, but they can be largely split into 3 categories. Not every category will be relevant for everyone, but it is important that we address and assess them all. They can be split into biomedical, musculoskeletal, and psychosocial categories, and we'll talk about each one in more detail in the following slides. Biomedical conditions that can cause pelvic pain are listed on this slide. It is a list of some of the conditions, but it is by no means exhaustive. It is important to remember that despite a biomedical diagnosis, there are likely to be influencing factors from the musculoskeletal and psychosocial categories that may occur as a result of or in addition to these conditions. It is important that we try to address as many of these factors as possible to successfully treat your symptoms, and we will explore these in more detail over the next few slides. As previously mentioned, there are likely to be influencing factors from the musculoskeletal system. Musculoskeletal means structures related to our musculoskeletal system, which include muscles, joints, ligaments, tendons, and nerves. It is important that the structures around our pelvis work efficiently. Some muscles may be weak, whilst others may be tight. When thinking about the musculoskeletal system around your pelvis, it can be helpful to imagine your pelvis is like a house. Your pelvic floor is your foundation. Your gluteal or bottom muscles are your back and side walls. Your abdominal muscles are like your front door, and your back and diaphragm like your roof. Imagine if a house had a floor or a wall that is weak. You would perhaps expect that this might affect other areas of the house. And the same can be said for your pelvis. If one area isn't doing its job effectively, this may cause another area to become problematic. For example, if your diaphragm doesn't contract and relax properly whilst breathing, your pelvic floor can become tight and overactive as a result. This tightness can lead to pain. Imagine walking around all day with your shoulders held up to your ears. You would expect this to feel painful after a while. Another example is having weakness in your bottom muscles. As your body continues to do the activities that use your bottom muscles, such as standing, walking, and stairs, these muscles get tired more easily if they are weak. Other muscles have to take on their job, again possibly leading to overworking and pain. At your one-to-one appointment, your physiotherapist will likely assess your musculoskeletal system, which may include your pelvic floor muscles and your diaphragm, and work out if any areas in your body are weak and whether any other areas are overactive due to compensation. You may then be given exercises to either strengthen weak muscles or stretch the tight, overactive muscles. Psychosocial influences relate to our own individual thoughts, beliefs, and behaviour, as well as external social factors, including work, family life, and hobbies. It is important to recognise that these can have a significant influence on the way our body responds to and is able to manage pain. Imagine, for example, you've slept well, been able to do all of your favourite activities during the day, and before you go to bed, you stub your toe. It will hurt, but likely settle. Now imagine you've slept badly, don't feel very well, have had a stressful day, and then you stub your toe. It will likely feel much worse. The injury is the same, but how your body responds to it is different. This shows that we can have a similar pain experience, but depending on a number of factors, we may be able to cope with it differently. We are going to discuss some of the specific factors that can influence pain on the next few slides. Remember, we may not be able to control all of these factors, but if we can manage them to the best of our ability, it will help us to reduce our symptoms more efficiently. When it comes to pain, we often describe these common factors as volume changes or volume controls. We touched on this earlier when we talked about the pain mechanisms and synapses. By trying to manage these effectively, we can help reduce our pain levels. Sleep. Many people believe that they need 8 hours sleep every night. However, a normal amount of sleep varies according to age, sex, physical and emotional health, lifestyle, work and social demands. As we get older, we need less sleep and have more wakeful periods through the night. This is normal. Comparing your own sleep with others is not a useful guide. Rather than focusing on the number of hours sleep that you are getting, it is more helpful to think about whether you are too tired to do what you need or want to do the next day. Many people believe they need 8 hours sleep every night. However, a normal amount of sleep varies according to age, sex, physical and emotional health, lifestyle, work and social demands. As we get older, we need less sleep and have more wakeful periods through the night. This is normal. Comparing your own sleep with others is not a useful guide. Rather than focusing on the number of hours sleep that you are getting, it is more helpful to think about whether you are too tired to do what you need or want to do the next day. So what is a normal night's sleep? Many people think that they should get into bed, go to sleep and remain in a deep sleep throughout the whole night. However, it is important to know that this is not a normal night's sleep. If you expect yourself to sleep like this, then you will always feel disappointed. During a normal night's sleep, people will fall asleep, but then they will enter times of much lighter sleep and will sometimes wake up, although they do not necessarily remember this. We have about 5 stages to our sleep, going from lighter to deeper sleep, and we go through these cycles about 4 to 5 times per night. This increases in number as we get older. Having persistent pain can often lead to sleep problems. For example, it can be hard to find a comfortable position, and staying in one position for too long can increase pain, and turning over can wake people up. Other reasons include normal aging, external disturbances, disrupted sleep routines, including daytime naps and lack of routine, too much rest with insufficient activity and exercise, stress, worry, anxiety, and emotional reasons, and also worrying about not being able to sleep. Some medical reasons, for example, needing the toilet at night, some medications and pain. Stimulants, including caffeine and nicotine. Clock watching, so having a look at the clock when you wake up. Watching television or using phones too late. Although they may feel relaxing at the time, it can induce many emotions and make your mind more active. So what can you do to help? We recommend that you think carefully about anything you may be doing that could be making it harder for you to sleep. Think about what are the problems and what you have tried to do about them. Try not to think, oh, I've tried that before, it doesn't work. It may be that you need to try it for longer, or that it may help in combination with something else. Try these suggestions listed. Try one or two at a time, then add another after about 2 weeks. It is important to be realistic in your expectations about how effective these will be. It will take time for you to notice any improvements, and some will be harder than others, and some will be more helpful than others. Avoid things that contain stimulants about 4 to 6 hours before bedtime and when you wake up at night. Caffeine is in coffee, tea, chocolate, some herbal teas and Coke. Cigarettes contain nicotine. Try to keep your evening alcohol intake low. Even if it initially helps you to sleep, alcohol can prevent restful sleep and can lead to waking up early the next day. Gradually increase your daytime activity and exercise. Aerobic exercise in the day will help you sleep at night, but avoid lots of strenuous exercise before going to bed. Try not to sleep even for a short time during the day, no matter how tired you feel. If you find yourself dozing during the day, get up and go for a walk. This helps your body and mind to make a clear distinction between day and night. Get up at the same time every morning, no matter how well or badly you slept the night before. This helps to keep your body clock regular. Have a wind down time, about an hour before you go to bed. This helps you to prepare mentally and physically for sleep. For example, turn the television off, have a warm bath and a warm drink, and do some relaxation. Do things in a regular order and make this a habit, following the same sequence every night. Use relaxation techniques and exercises to help you sleep. Try not to use your bedroom during the day if possible. The bedroom should be used for sleep, not computers, loud music, television, etc. This will help your body to associate the bedroom with sleep. If you have not gone to sleep within about 15 to 20 minutes, get up, go to another room, and do a restful, not stimulating activity until you feel sleepy again. Then return to bed. A restful activity does not mean watching an exciting film or reading an exciting book. This will only stimulate your mind even more and reduce the chances of you returning to sleep. If you wake up at night, do not look at the clock. Knowing the time will only irritate or worry you. Put the clock in a drawer or turn it round so you cannot see the face. But make sure that you'll be able to hear the alarm if you need to get up at a certain time. Try some relaxation to help you return to sleep. Remember, lying in bed relaxed is refreshing even if you are not asleep. Worrying at night will keep you awake. Give yourself some time, well before bedtime, to write down your worries and what you plan to do about them the next day. If you wake up in the night, remind yourself that you have given these some time already, that going over it now will not help, and that you can think about it the next day. Remember that you will not be able to sleep well every night, and you will have some sleepless nights. This is normal for everybody. And please remember, it will take time for these methods to improve your sleep. Exercise releases endorphins, which are our happy hormone, as well as improving strength and mobility. You should aim for about 30 minutes of moderate exercise 5 times a week. Your pelvic health physiotherapist can guide you as to the most appropriate type of exercise for you. Often people with persistent pain tend to arrange their lives to avoid activity in an attempt to reduce the pain. However, the research shows that as you become less active, you also become less fit. Joints become stiffer, muscles become weaker, and pain increases when you do minimal activity. Some people may feel that this pain is something to be concerned about. They may believe that the pain on moving is a warning signal that damage is occurring and that movement and exercise should be avoided. However, this is untrue. Exercise is an important part of pain management. It can help to reverse the downward spiral of reduced fitness and increased stiffness. It can be difficult to know where to start with exercise. The most important thing is not to push yourself. You need to find a level that you can do regularly without increasing your pain too much. When you feel confident with doing the exercise, you can build up slowly using pacing skills. It is normal to feel muscle pain when anyone begins a new exercise after a period of not exercising. This additional pain is to be expected and will settle as you maintain your exercise program. Remember, a flare-up or increase in pain is not a warning of damage. You may find that your persistent pain is aggravated when you start exercising. The exercises that you learn with your physio are not dangerous and will not cause an injury, but overdoing can aggravate your pain. The pain caused by overdoing can be greatly reduced by finding your baseline, exercising regularly and gently, and by gently increasing as you get fitter. The aims of exercise are to increase fitness and enable activities to become easier, reduce stiffness and help you to move more easily, help you to start feeling stronger, increase your confidence with doing exercise, and returning to activities that you want to do. You will be given the links to some types of exercises that we know can be helpful for persistent pain. Different types of exercise. Strengthening exercises make muscles stronger. Building up weak muscles will help you to do more. Aerobic exercise, also called cardiovascular exercise, is a way of exercising the heart and lungs. It will help to increase your fitness and stamina. Stretching exercises help with stiff, tight muscles and joints, which can add to your discomfort. Stretching will help to loosen joints, lengthen muscles and scar tissue. For best results, stretches should be done gently, slowly and smoothly. You should get a gentle stretch feeling, but not an increase in pain. You should stretch until you feel some resistance, then stop at the borderline between your usual pain and increased pain. Do not push into the pain. This will not cause any damage, but will increase muscle tension and pain, possibly leading to a flare-up, and therefore minimizing any benefits gained. Soft tissues like to be stretched in a slow, gentle and smooth way, and as you practice regularly, you will feel less resistance and will be able to stretch further. Research tells us that the most effective time to hold a stretch for is between 15 and 30 seconds. If you only stretch to the point of resistance and not into pain, then holding the stretch for 15 to 30 seconds will not cause any problems. It is a really good idea to monitor your breathing when you stretch. Use your breath as a way of timing the stretch. You may find that 15 to 30 seconds is too much to start with. Therefore, starting at a lower level can be helpful. If you find that you are holding your breath, grunting or groaning or clenching your fists or tensing your shoulder muscles, gritting your teeth and screwing up your face, it might indicate that you are stretching too far. If this is happening, take a few deep breaths and start again in a more gentle and relaxed way. Research has shown that smoking increases injury healing times, as well as putting people more at risk of developing persistent pain. Additionally, having a persistent chronic cough places extreme pressure on the pelvic floor. Stress and anxiety are a natural part of the fight or flight response and the body's reaction to danger. The purpose of this response is to ensure a person is alert, focused, and ready to deal with a threat. Both stress and anxiety are normal, although they can sometimes overwhelm people. Stress and anxiety are both a part of the body's natural fight or flight response. When someone feels under threat, their body releases stress hormones. This response allows a person to be ready to either fight or run away. They also breathe faster and their blood pressure goes up. This process happens really quickly, and experts call it stress. Anxiety is the body's response to that stress. Many people will recognize anxiety as the feeling of distress, unease, or dread that someone has before a significant event. It keeps them alert and aware. The fight or flight response can kick in when someone faces a physical or emotional, real or perceived threat. While it can be useful for some people, it can interfere with everyday life. Listed below are some physical effects of stress and anxiety. It is normal to have fluctuating stress levels in our lives, and a certain level is required in order to function. However, if symptoms of stress or anxiety become persistent or increasingly intrusive on day-to-day life, this can affect our pain levels. Not only can it lead to muscle tightness, but it can reduce our pain threshold. If this is something that you feel you need more help to manage, please discuss with your GP, or alternatively you can contact Surrey Mind Matters. This is a local NHS provider offering free and confidential talking therapies to people aged 17 plus registered with the Surrey GP. You can easily access the service. Simply go to their website and you can refer yourself via the link or via the phone number on the website. There are many different relaxation strategies that can help people to cope with stress and anxiety. Everyone is different and responds better to different strategies. It may take time and perseverance to find the right strategy for you. Examples of relaxation strategies include mindfulness and meditation. Headspace is a great app for helping with mindfulness and meditation. Breathing exercises, body scanning, exercise including yoga, Pilates and Tai Chi can all be found on the videos linked to this. Other strategies are visualization, listening to music, reading a book. Once you've found your relaxation strategy, it takes time and practice to be able to use this to help cope with stress and anxiety. Flare-ups and management. Although persistent pain can be constant, it is often varying in intensity or severity. People often say that they have some days that are worse than others. This fluctuation in pain is normal. When an increase in your normal level of pain lasts for longer than 2 hours, but less than 2 days, we call this a flare-up in your pain. Sometimes it is possible to recognize what has caused a flare-up. It can be helpful to think about what you have been doing a few days before the flare-up began. The causes of a flare-up often include overdoing an activity, for example, walking too long or carrying something too heavy, resting for too long, or not taking enough short breaks. However, flare-ups can also happen for no apparent reason. If you cannot work out what may have caused it, then it is better to start thinking about how you can manage your flare-up. So what is the best thing to do when you have a flare-up? It's very important to keep going with your pain management skills during this time. Pacing is essential. This will prevent you from resting for too long or from overdoing an activity. It can be tempting to be guided by the pain and do less on the days when you have a flare-up, but letting this happen will mean the pain, not you, is in control of your activity level and what you do. You are more likely to go back into the overactivity, underactivity cycle, which can lead to more difficulties. You will spend a period of time being quite inactive, which means you will become stiffer and lose some fitness, and so it will be harder to build up again. You may not achieve anything or do anything that you enjoy, and this may lower your mood. So when your pain is flared up, it is important that you do not rest too much, but do not push yourself so that your pain increases further. Experiencing an increase in pain can be hard to manage. It is therefore important to think about and use all the pain management skills that you will learn. These are some things that may help you. Stretches and exercise are important during these days, even though you may not feel like doing them. People sometimes feel like they cannot move any part of their body on these days. However, if you start the stretches that involve a less painful part of your body, you may find that you can then begin to stretch the more painful areas. Doing the stretches gently and slowly on these days is important. Some people find it helpful to spread them out over the day rather than doing them all at once. Medication can be helpful for some people during a flare-up of their pain. However, try your pain management skills as well as taking medication. If you decide to use medication, make sure you take no more than the recommended dose. Take it at regular time intervals as prescribed or as written on the box or bottle, rather than taking it all at once or trying not to take it until your pain is unbearable. Have a plan to reduce your medication back to its normal level, or to have stopped your medication if you were not taking it before within 7 days. Plan a gradual reduction rather than suddenly going back down to the amounts that you were taking before your flare-up. Relaxation can be helpful when you have a flare-up. When pain increases, your body may become tense and your breathing may become shallow, and you may find that you are breathing in your upper chest rather than down near your abdomen. Relaxation does not have to be about lying down for a long time. This can be hard during a flare-up. Use relaxation skills even for 2 to 3 minutes, and that can be helpful. Examples of relaxation may include body scanning, abdominal breathing, and examples of this can be found on the short videos linked to this presentation. Other activities. Using your pain management skills to help you during a flare-up does not mean stopping everything else that you have planned for the day. It is important that you think about what you have planned and prioritize the things that need doing or that you want to do. This may mean rescheduling some things, but not everything. Stick to a few plans, even if it means you change them slightly. For example, if you have planned to meet a friend in town, maybe arrange to meet them locally or in your home. Try to plan 1 or 2 enjoyable things to do during the day. Even though you may not gain as much enjoyment from them as you usually do, it may help to lift your mood a little. Concentrating and planning can be hard during a flare-up. This can make it hard to decide what to do to manage your pain. Therefore, having a prepared checklist of things to do that will help you during a flare-up may help you to manage this difficult time a little more easily. A checklist is a list of activities and pain management strategies that you find useful and helpful during a flare-up. It may help to write down each one and plan how long to do it for. The aim of a checklist is not to reduce your pain, but to help you manage your flare-up and maybe to prevent it from becoming worse. When you are working towards a goal and developing ways to do more things, even though you have pain, it is important to pace your activity. Pacing will help you to break out of activity cycling and maintain a fairly even level of activity day by day. It will help you to start new activities or activities that you have stopped without causing an increase in pain. Pacing puts you, rather than the pain, in control and allows you to make plans. When someone is activity cycling, it tends to be their pain that is guiding the amount of activity that they do. Rather than the pain guiding your level of activity, it is more helpful if time, for example, number of minutes, guides your activity level. Pacing can be applied to exercises, daily activities, and general positions, for example, sitting and standing. Pacing involves not overdoing activities or staying in positions for too long, breaking up goals, tasks, and activities into smaller parts that you can do without an increase in your pain. Doing small amounts of regular activity rather than large amounts, followed by long rests. Gradually building up the amount of activity that you are doing. Pacing can be effective in helping to increase activity levels without causing an increase in pain. However, learning how to pace takes time and practice. Pacing can help to reduce the number of flare-ups or increases in your pain you experience. However, due to the nature of persistent pain, you will likely still experience some flare-ups no matter how much you pace your activity. This can be frustrating, but it does not mean that you are back to square one. There are several additional options that may be helpful for your pelvic pain symptoms. Desensitization massage, which can help to retrain sensitive tissues. Sex advice, including use of appropriate lubrication brands and positions that may be more comfortable for you. Equipment, including dilators, Therawands, and vibrators. And medication to help reduce the sensitivity of the tissues in your vulva and vagina. Remember, not all treatment options will be relevant for you and your symptoms, and these will be discussed by your pelvic health physio if relevant to you. What to do next? Today is the start of your treatment. Education and knowledge is key, and hopefully after watching this video, you feel you may have a little more of this regarding persistent pelvic pain. Please start to put the advice from this video into practice as much as possible, including the short videos giving information about different types of exercise and relaxation methods. You will already be on our waiting list for your one-to-one appointment with a pelvic health physiotherapist. You may have already received an appointment date from us. If you have not received an appointment, please contact us if you have not heard from us 8 weeks from receiving this video. Please call or email on the details below.